A recent study found that many of the herbal supplements sold in stores nationwide do not contain what their labels claim. In fact, many are made up of fillers like soybeans and rice. Anahad O'Connor gives us the bad news in this week's Science Times, and he joins me today. Hi, Anahad.
Hello.
So who are these researchers and what exactly did they do?
So these are researchers at the University of Guelph who used a sophisticated DNA barcoding technology where they were able to essentially look at different herbal supplements and determine if what they said on the label was what was contained in the bottle.
These were sold in American stores?
Yeah, so these were supplements, a lot of popular ones like echinacea, St. John's wort, that were sold in the U.S. and Canada.
Now, these are hugely popular in the U.S.
Yes.
I mean, herbs are a $5 million business now?
$5 billion.
$5 billion,
industry.
okay.
Yeah.
Do we know what percentage of the U.S. population relies on these things?
It varies from one study to the next, but it's definitely a sizable proportion of the population, and it's also a very fast-growing sector or part of the alternative medicine market.
So these researchers, they go into the stores, they do DNA testing on what's actually in the bottles that we think are St. John's wort and echinacea. What did they find?
So they found that in about 20% or about a third of these bottles, what was actually in the pills was not what was said on the label. So something would have said echinacea on the label, but there was none of that in the bottle. Instead, in many cases, they found rice, wheat, other things that are known as cheap fillers, or they found other plants altogether. In one case, I believe it was a product of St. John's wort. They found that there was a laxative in these capsules and not St. John's wort. They found black walnut in another product, which is a hazard for people with nut allergies. So they found a lot of issues.
Were these products more often than not adulterated in some way? Was there a filler, or was it the case that they simply just didn't contain the product that they said on the label?
Yeah, so in about a third of the products, there was outright substitution. So none of the listed herb in the actual pill. And in about, I think, 60% of the products, there was adulteration. So either fillers like rice or wheat or soy, or just other plants mixed in and things that were not listed on the label that consumers would want to know about.
Well, I know a lot of readers are going to be wondering, how could this happen? Everything else in the food marketplace is at least somewhat regulated, although maybe not as much as it should be. But how do we wind up with supplements that are completely not what they say they are to consumers?
So the issue is that back in 1994, there was a federal law put in place that basically loosened a lot of the regulations on supplements. And this was led by Senator Orrin Hatch and some others who said they wanted to essentially improve access to supplements for Americans. But what this does is it loosened a lot of the regulations, and it basically set it up so that people could cut corners. So if you look at the prescription drug market, where a lot of, where all these drugs have to go through clinical trials and, drug makers have to essentially show that their drugs are safe and relatively effective before they put them on the market. With the supplement industry, it basically works in reverse. As long as you're not introducing a brand new chemical or ingredient, you can basically put, your supplement on the market, and then it's up to the FDA to prove that your product is unsafe as far as actually as far as quality control.
All right, so buyer beware.
Buyer beware.
Thanks for being with us.
Thank you.